Hello and welcome to the ACE-IT podcast, where we turn science into sense. This is the lucky 13th season of ACE-IT, and we could not be more proud to deliver the rich scientific content to you in a usable and understandable way. ACE-IT is brought to you via the Justice Community Overdose Innovation Network, or JCOIN. If you're new to ACE-IT, welcome, and check out the prior seasons to begin or continue your learning journey. We are exceptionally grateful for every listener, and we promise we will continue working to help you learn and never let you down. Also, a quick plug for a few other JCOIN features. Did you know that you can get technical assistance for your organization from the experts at JCOIN? And did you know you can apply for small research grants to help fund an innovative study idea? Yep, also through JCOIN. And did you know you can apply to be a JCOIN Leap Scholar or investigator to improve your own skills? Also through JCOIN. If any or all of these exciting offerings sound interesting to you, check out our website, www.jcoin-ctc.org, and learn about the many JCOIN offerings beyond ACE-IT that may help you learn and grow in ways that improve lives, including your own. With that, I'm honored that you're with us. I'm Danielle Rudes, your host, and this is ACE-IT. And we are deep in the weeds of season 13 of the ACE-IT podcast, titled Evolving Responses to Opioid Use Disorder and Overdose. In this season, we're examining the shift in prevention, treatment, and recovery strategies in response to the ongoing opioid and overdose crisis in the United States and beyond. From emerging clinical approaches to peer-led efforts, we're highlighting the many ways individuals and systems are adapting to save lives and support recovery. Today, we're taking a trip to Canada. In this episode, we're diving into a topic that's at the center of a lot of discussion in harm reduction and substance use treatment: safer supply and prescribed alternatives. While safer supply has been gaining traction in Canada, it's just beginning to enter conversations in the United States. Washington State, for example, has recently explored it through a legislative work group, the Washington State Healthcare Authority 2024. So today, we look north for lessons learned, and then back here at home to see what possibilities are starting to emerge. Okay, so first we should probably cover what exactly safer supply is. At its core, safer supply means providing people who use drugs with prescribed pharmaceutical alternatives to the unregulated street supply. According to the Government of Canada, the idea is pretty straightforward. If the toxic and unpredictable nature of the illicit drug market is what's killing people, then a regulated source of medications of known quality, dose, and composition can reduce those risks. The practice grew out of Canada's response to escalating overdose deaths. Since the mid-2010s, Canadian doctors and nurse practitioners have prescribed pharmaceutical opioids like hydromorphone and even diacetylmorphine, as well as stimulants and benzodiazepines, to people at high risk of overdose. Like traditional opioid agonist treatments, safer supply programs are not necessarily focused on abstinence. Instead, they prioritize survival, stability, and connection to other health and social supports. Importantly, advocates stress the word safer rather than safe. No drug use is entirely without risk, but regulated opioids are much safer than what's available in the illicit market. All right, so now that we've covered what safer supply is and why it was introduced, let's talk about what the available evidence says about safer supply. Now, this is a relatively new practice, so findings are coming out all the time, but the emerging research is pretty encouraging. Looking at health and social outcomes, according to reports from the Government of Canada and the Washington State Healthcare Authority and a supply by Cola and colleagues 2024, participants in safer supply programs report fewer overdoses, less reliance on fentanyl or other illicit drugs, and improved physical and mental health. Studies link safer supply with reduced hospital visits, fewer infections, declines in criminal activity, and greater access to housing and employment. That is all really great news. Not only is it safer to have a safer supply reducing deaths, it is also a way of linking people up to programs and services that are crucial for their physical, mental, and social well-being. Turning to the perspectives of people who use safer supply programs, Kola and colleagues 2024 interviewed 16 participants in British Columbia, and interviewees highlight the relief that comes with reliable access to medications. People describe safer supply as life-saving, allowing them to stabilize, manage cravings, and regain control. McNeil and colleagues 2022 conducted a similar study, interviewing 40 safer supply users in British Columbia, and found that beyond the medications themselves, many appreciate that these programs are more compassionate and less stigmatizing than other healthcare encounters. That said, participants also raised some concerns, like the need for stronger doses, more medication options, or routes of administration beyond oral pills. Without those adjustments, safer supplies often can't fully replace the street supply. That comes from a study conducted by Kola and colleagues 2024. Okay, so what do the people prescribing and providing the medications have to say about safer supply? On the prescriber side, evidence shows both opportunities and hesitations. Pauly and colleagues 2024 conducted a mixed method study analyzing administrative health data and interviewed 17 prescribers in British Columbia. They found that providers who adopt safer supply often do so in urban settings with large, complex caseloads. So that tells us right now this practice may be more available for people living in urban areas compared to rural areas. Also, nurse practitioners in some cases have been more likely than physicians to prescribe. Yet many clinicians remain wary, citing fears of professional scrutiny, audits, or being blamed for contributing to the overdose crisis. Those findings come from that study conducted by Pauly and colleagues in 2024, as well as another study by Karamosian and colleagues 2023, who analyzed organizational program process reports from pilot safer supply programs located in British Columbia, Ontario, and New Brunswick. However, despite those concerns, studies consistently show that both patients and providers recognize safer supplies as a crucial tool in reducing overdose risks and improving quality of life. Alrighty, now let's talk about lessons learned from implementation studies. As a reminder, implementation studies are research projects that look at how a new program or policy actually works when it's put into practice in the real world. Research on how safer supply programs are rolled out underscores just how much context matters. According to Karamosian and colleagues 2023, early programs in Canada encountered challenges like staff shortages, limited physical space, insufficient funding, and overly medicalized models that created barriers for participants. And Pauly and colleagues 2024 found that structural inequalities such as poverty, stigma, and lack of trust in medical systems also limited access. On the other hand, where programs succeeded, they emphasized flexibility, offering multiple medication options, reducing rigid eligibility criteria, and meeting people in accessible locations like community health centers or supportive housing. That finding comes from that report from the Government of Canada 2023. According to Kola and colleagues 2024, trust and compassion from providers were equally important. Additionally, Kurz and colleagues 2024 highlight the role of peer networks. In British Columbia, prescribers were far more likely to adopt safer supply if their colleagues were already doing so, suggesting that professional relationships strongly influence uptake. Okay. With that, we've reached the end of our episode on safer supply and prescribed alternatives. So what can we take away? Well, safer supply and prescribed alternatives aren't a silver bullet, but they offer a pragmatic response to the drug crisis. The evidence shows reductions in overdose and improvements in health and stability. Participants describe the programs as compassionate and life-saving. Providers, while sometimes hesitant, are finding ways to integrate safer supply into care. And from an implementation standpoint, the lesson is clear. Programs must be flexible, adequately resourced, and grounded in trust, with both the communities they serve and the providers who deliver them. As Washington State and other U.S. jurisdictions begin to explore safer supply, Canada's experience provides a roadmap, one that shows both the potential of this approach and the pitfalls to avoid. Thanks for joining me in this conversation. I'll talk to you again on the next episode of Aced It. Thank you for listening to the Aced It podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write me. Danielle Roods at Sam Houston State University in Texas. My email is droods@shsu.edu. And of course, thank you to the Justice Community Overdose Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous and amazing scriptwriters, and also my fabulous and amazing doctoral students, Bryce Kushmarek-McCune, Jalen Magana, and Caitlin Bauer. And a huge and heartfelt thank you to the team at Slonky LLC for their wonderful production as always. Tune in again soon for another episode and even a whole nother season of Aced It.